My name is Sheryle Prince. I live in Ohio. I'm a pediatric registered nurse, retired. I have two beautiful children, Melissa and Timmy. And I've been married. My husband and I have been together 17 years. Married 15, together for 17. I'm autistic. My ATEC score is 106. And now Melissa's not autistic at all. My husband isn't. Timmy is. Timmy's 14. And he's autistic. But he speaks. He said he wouldn't, and he does. And he's doing a lot of things he said he would never be able to do. Wonderful, wonderful kid. He really is a good kid. Autism is a disease. My son and I, there are certain enzymes that our bodies should make and they don't. And there are enzymes that help you to digest proteins and get them to a form where the body can use them to feed and develop the cells. And it's not just the brain or the communication center that's affected. They did a 10-year study and proved that it affects glands, it affects muscles and coordination, the gastrointestinal tract, that's a big one. That also affects your immune system. It does affect the brain development some. An autistic's natural language is body language. We don't pay as much attention to the face, but we really read body language pretty quickly. We learn that pretty quickly. Since verbal language is in our first language, that's more difficult. But I managed to get through school and college, and I finished high school. When I was done with the 10th grade, I needed 1 credit to graduate. I got good grades in school. I didn't have any trouble with college. I would think I chose nursing because I wanted something where I could be around people. And people have said to me, wouldn't it be difficult to be autistic and be a job like a nurse where you have to deal with people so much? And I say, no, because you go into the room, you have a purpose. You got a pill or a treatment, you got something planned that you're going to do. You're not in there to have a sustained conversation or develop a friendship. You're there for a particular reason. And I have, with my son Timmy, I've developed an early childhood program that helps. It's especially good for parents, although a therapist could do it, but for parents or siblings, if you have those, to work with, so that they get more comfortable, the toddlers, with having people touch them. Of course, now we have enzymes. You can give the artificial enzyme, and I have seen one little boy, 3.5. I couldn't get over how well he does, but he's been on the diet and enzymes for over a year, and it's just been wonderful. Timmy and I both take our enzymes. It has helped a lot. I have the colitis that goes with it. I have I'm sick a lot. I pick up everything. But Timmy's not that way. His immune system seems to work pretty well. I hope it stays that way. And I want to get on here, and Tim and I are going to do video diaries. And so we'll try to get on every day. and give you little updates, and there's a whole lot more I want to tell. I want people to know about autism and about how it affects a person as they grow older. With the little kids, we've learned a good bit about that, but when it gets to adulthood, and how does it affect you as an adult? And it does affect you, most definitely. My husband and I get along great. We don't fight. We have a disagreement. We sit down and talk about it, talk it over. There are times when he'll put his foot down and say no about something that I want or would like to do. He's a little more practical. But, I have been able to learn some tricks over the years. Little things I've learned to do that, so that when I'm in a situation where I'm going to be around other people outside of the nursing center. For instance, for me, did want to get to know some of my coworkers, and I noticed that when they would go to break, they would talk about their soap operas, their shows, their stories, they call them. And so I got a subscription to Soap Opera Digest, and I would read that every week, and then if I happened to be in the break room, I knew what they were talking about when they talked about their stories. I was able to at least contribute something to what they were talking about, and I knew what they were talking about. But I've never been a big one to go to the break room anyway. I would much rather spend time with patients. I started out in geriatrics, and then they had a facility right next door, which was MRDD, teens, young adults, and the other nurses had to take turns going down there to fill in on the regular nurses' days off. And we worked 12-hour shifts at that time. I hadn't gone yet because I'd only been out of nurses training for a couple of months, and the directors wanted me to have a little more experience before I went down there to work. When you worked in this building, there weren't any other nurses in the building, so, and I think she was a bit nervous that she might scare me off. But I got down there, and when I started working with the kids, it just was the most wonderful experience for me. The next day I came into work, and she was like, did everything go okay? You alright? And I got to go because late nurse, another nurse, Madeline Ashton, she said, she refused to go. She said, I'll quit before I'll go down there and work. I will not work there. And I said, let me go. Let me try. So I went, and I just absolutely loved it. I came back the next day that I was working, and I told her, I said, can I have that day? You need somebody for that day every week. Can I have that day? Every week, all the time. And she's, you kidding? No, I loved it. I really did. These were people I could relate to. They were more, we had quite a few that were nonverbal that understood how body language works, how settings work, and it was a great experience for me because I learned about training, how to do the different plans and training, doing the hand over hand and doing the cues and when to pull back. And so when Timmy was little, it was easier for me to work with him because I knew how to do that kind of work in the first place. I've had some real interesting experiences, but one of the things I want to say, I'm getting ready to close here in a minute, but autism can be a gift if you make it one. It can be, yeah, it's hard sometimes, it is, but there have been times in my nursing career where I found things, noticed things, because I can notice, I pick up on little detail changes, just little things that I pick up on that others didn't, and I was able to catch, I've had two patients that I actually was able to save. I had a couple of patients with broken bones that I was able to feel that the other nurses didn't feel, and I was always right. I just was really able to pick up on those things. And since I didn't have to talk, I wasn't in there to do conversation, I was in there to do something else, I learned what questions to ask to get the patient to start talking, and that got their mind off of what I was doing, which made me, I was the tube whiz. If you needed a tube put anywhere, anytime, and you couldn't get it, they would call me and say, get her. And we had one fella who had to be cathed twice during the night, and I was on night shift, and twice during the day I was on day shift, and if he found him, he would ask if I was in the building, and if I was there, he wouldn't let anybody else do it but me. He thought I just knew what I was doing, but I would get him talking and just distract him, and you can never use too much lubrication. When you're putting a tube in, lube, and not just a little packet, lube. And you want it to slide in, it's easier on the patient, it's easier on you, but it has been a good thing. It does have good things to it. It's not all bad. It's not a horrible disability. There are things that I can't do that I could never do that, but everybody's that way, and that's one of my biggest hurdles to get over was to finally realize that I'm not the only person who has problems, so that everybody does, even those people that you look up to and think, oh, they're perfect, they're normal, they're perfect. I don't even use the word normal too much anymore. I prefer the word average. And I don't think I'm less than. There's certain things that an average person has that I don't. But then there are special powers I have that they don't. So it all works out in the end. My greatest wish is to be able to pass on to other autistics that you can do this. I started talking 3 years ago. My son was talking to himself. He said, I am so worthless. And it just broke my heart, and I thought, the only way I'm going to be able to save him that pain is if he sees me break through that barrier. And Tom Pappas, who works for Autism Speaks in Ohio, he told me, he said, what you need to do, we need you, they need to see that autism research does make a difference. If there are autistics out there who work, who can, taxpayer for many years, and was able to help people. I was able to have a wonderful, normal marriage, and So I'm not all that different. But we'll get into that some more later. Right now I have to go. I wish you well, and I'll see you again.